Urinary system. Urinary system, also known as renal system, produces, stores, excrete urine via filtration mechanism in which potentially harmful molecules are removed from the body. It also plays a crucial role in homeostasis, electrolyte, and acid-base balance and red blood cell production. The human urinary tract is comprised of 2 kidneys, 2 ureters, 1 bladder, 2 sphincter, and 1 urethra. Normal urine output has 0.5 to 1.5 cubic centimeter kilometer per hour. A patient should be urinating at least every 6 hours. In oliguria, decreased urine output has 300 cubic centimeter m square in 24 hours. In children, it has 0.5 cubic centimeter kilogram per hour. Infant, 1.0 cubic centimeter kilometer per hour. Usually, 500 cubic centimeter per day in adults. In anura, no or minimal urine output is usually 100 ml per day in adults.
What are the factors affecting urine output? First, growth and development, psychosocial factors, fluid and food intake, medications, muscle tone and activity, pathologic conditions, surgical and diagnostic procedure. How does urinary system work? Blood is transported to the kidneys via the renal artery. A system of filtration units within the kidney regulates level of dilution, salts, and other small molecules in the filtrate. Any excess of or undesired products travel through each ureter and are deposited into the reservoir of the bladder, while purified blood re-enters the circulatory system by way of the renal tube. Urine is stored in the bladder until the urinary nervous system releases the contents through the urethra and out of the body. The passing of urine is known as urination.
Kidney. The kidney are tubing-shaped organs, each about the size of the fist. They are located just below the rib cage, one of each sides of your spine. Your kidneys remove waste and extra fluid from your body. Your kidney also remove acid that is produced by the cells of your body and maintain a health balance. Kidney also make hormones that help control your blood pressure, make red blood cells, keep your bones strong and healthy. Ureter. The ureter is a tube that carries urine from the kidney to the urinary bladder. There are 2 ureters, one attached to each kidney. The upper half of the ureter is located in the pelvic area. The muscular layer are responsible for the peristaltic activity that the ureter uses to move the urine from the kidney to the bladder.
Next is bladder. The urinary bladder is an hollow muscular sac in the pelvic, just above and behind the pubic bone. The appearance of bladder varies depending on the amount of urine stored. When it's full, it exhibits an oval shape, and when empty, it is flattened by an overlying bowl. The bladder is an organ of the urinary system. It plays 2 main roles: temporary storage of urine and assists in the expulsion of urine. So, bladder is located in our lower abdomen. It is held in place by a ligament that are attached to our organs and the pelvic bone. And bladder's walls can be relaxed and expand to store urine, and contract in the flattened to an empty urine through the urethra. The typical healthy adult bladder can store up to 2 cups of urine for 2 to 5 urethra. Urethra tract that transmits urine from the bladder to the exterior of the body during urination. It is the tube that carries urine from the urinary bladder to the outside of the body. So the urethra is held close by the urethral sphincter, a muscular structure that helps keep urine in the bladder until voiding can occur. And the function of urethra is depending on the gender. In female, it has only one function. It can transport urine to the exterior of the body, while male has 2 functions: transportation of urine and semen. This tube allows urine to pass outside the body.
The urinary system is susceptible to a variety of infections and other problems, including blockages and injuries. This can be treated by a urologist or another healthcare professional who is specialized in the renal system. Urinary tract infection. The most common urinary system disorder or disease is a urinary tract infection. UTIs are caused by bacteria in the urinary system. The signs and symptoms of a UTI are painful urination, burning urination, itching, and cloudy urine. Incontinence, a disorder where urination control is partially or completely lost. The most obvious sign of this disorder is person wetting themselves. A symptom is not being able to hold urine in the bladder. This disorder can be caused by the weakening of the pelvic floor muscle or loss of control of the urinary sphincter. Retention. Retention is almost exact opposite of incontinence. This disorder is when a person is unable to release urine from the urinary bladder. Retention occurs because of loss of control of the urinary sphincter that sits at the bottom of the urinary bladder, where it joins the urethra. Signs and symptoms of retention include not being able to urinate, feeling of fullness in the bladder, and in some cases, pain as the urine backs up in the urinary tract. Kidney stones. Urethral stones are kidney stones that get stuck in one or both ureters. Urethral stones can block the flow of the urine and cause severe pain. The larger stones can be problematic as they result in a blockage. These stones form due to the chemical imbalance in the urine. Drinking a large number of fluid is highly recommended for the prevention of all kinds of stones. Urinary system and reproduction, or urogenital system. The urogenital system includes both the reproductive organs and the excretory organs. They are considered together because they share some common ducts. These are grouped together because of their proximity to each other, their common embryological origin, and the use of common pathways, like the male urethra. Also, because of their proximity, the systems are sometimes imaged together. Thank you. What would happen without the urinary system? You can think of it as your body drainage system. As a system, it filters, transports, stores, and expels the excess water and waste products in your blood. The filtration performed by the urinary tract is vital to keep the body healthy. Without the system, your blood will be full of waste products and extra water.